Losing your hair can be really scary. It can make you feel self-conscious and affect your confidence. Believe me, I get it. As a dermatologist, I see so many people struggling with this, and I want you to know you're not alone. Hair loss is surprisingly common in women. It can happen at any age, and it doesn't discriminate. Whether you're noticing a wider part, thinning at the crown, or more hair in your brush, it's important to remember that you're not alone on this journey. We're in this together. There are many reasons why hair loss happens. Sometimes it's temporary, and sometimes it's a sign of something else going on in your body. But the good news is there are answers, and there's help available. So let's dive in and break down the mystery of hair loss together. Knowledge is power, and understanding what's happening is the first step to feeling better and finding the right solutions for you. Hair loss can feel like a huge mystery, but it doesn't have to be. Let's break down some common culprits. Hormones play a big role in hair growth. Big changes like pregnancy, childbirth, and menopause can really mess with your hormones, and that can lead to hair loss. Thyroid problems can also be a factor. Ever hear the saying, "You are what you eat"? Well, it's true for your hair too. Not getting enough iron, zinc, or biotin in your diet can sometimes contribute to hair loss. Sometimes hair loss runs in the family. If your mom or grandma experienced hair thinning, you might be genetically predisposed to it too. This type is called androgenic alopecia, and it's the most common type of hair loss in women. Stress is a real drag, and it can show up in your hair. Major stress can sometimes push your hair follicles into a resting phase, and that can lead to noticeable shedding a few months later. Certain medical conditions and medications can also cause hair loss as a side effect. It's always a good idea to talk to your doctor about any medications you're taking. They can help you figure out if it's a contributing factor. Let's clear the air about some common hair loss myths. First of all, it's not true that only men experience significant hair loss. Women lose their hair too, and it's more common than you might think. And what about that age-old belief that washing your hair every day makes it fall out? Totally not true. Washing your hair regularly is actually good for your scalp health, and it won't cause hair loss. Another myth. Wearing hats or using styling products causes hair loss. Nope. While tight hairstyles that pull on your hair can cause breakage, hats and styling products themselves won't lead to hair loss. Remember, it's important to separate fact from fiction when it comes to hair loss. Don't let these myths stress you out. Section 4. The challenge of diagnosis. Untangling the web. Figuring out the exact cause of your hair loss can be a bit tricky. It's often a combination of factors, not just one thing. For example, you might have a genetic predisposition to hair loss, but then stress or a nutritional deficiency could make it worse. See how it gets complicated? That's why it's important to pay attention to your body and any changes you notice. Keep track of when your hair loss started, any other symptoms you're experiencing, and any major life events that might be playing a role. This information will be super helpful for your doctor when you're trying to get to the bottom of your hair loss. They'll be like detectives, piecing together the clues to find the best course of action for you. Section 5. Taking charge, your hair loss toolkit. While it's essential to work with your doctor to address the root cause of your hair loss, there are things you can do on your own to support healthy hair growth. Consider these tips your hair care toolkit. First, nourish your body from the inside out. Eating a balanced diet packed with fruits, veggies, lean proteins, and healthy fats can make a real difference. Next up, manage your stress levels. Easier said than done, right? But finding healthy ways to cope with stress, like exercise, meditation, or spending time in nature, can benefit both your mind and your hair. Be kind to your hair. Avoid hairstyles that pull on your strands, and treat your hair gently when brushing and styling. And remember, there's no shame in seeking a little help from products designed to support hair growth. Look for shampoos and conditioners formulated with ingredients that promote scalp health and strengthen hair follicles. Section 6. When to see a professional. Getting the right help. If you're concerned about hair loss, don't hesitate to reach out to a dermatologist or a trichologist, a hair and scalp specialist. They can help you get to the bottom of what's going on. During your appointment, they'll examine your scalp, ask about your medical history, and may even order some blood tests to check for any underlying conditions. Based on their diagnosis, they can recommend the best course of treatment for you. This might include medications, therapies, or even lifestyle changes. Section 7. You've got this hope and support. I know dealing with hair loss can be tough, but remember, you're not alone. Millions of women experience it, and there's no shame in seeking help. Early intervention is key, so if you're noticing more hair loss than usual, don't wait to talk to a professional. And remember, your worth isn't defined by your hair. You are beautiful and strong, regardless of what's happening on top of your head. It can be really helpful to connect with others who understand what you're going through. Don't be afraid to share your story and lean on your support system.